Okay, so today we celebrate and acknowledge World Hepatitis Day, which in fact, as we all heard, is tomorrow. Now, 3 years ago, we were fortunate to have Professor Margaret Hellard and Frank Carlus present to us about their hepatitis research and experiences. And a lot has happened since then. And so today we're fortunate to have Professor Hellard back with us to speak on the current status of viral hepatitis incidence and current medical research initiatives, followed by Frank, who will deliver his lived experience presentation. Professor Hellard has years of experience in the area of infectious diseases, including hepatitis, preventing their transmission and identifying the impact of these infections in vulnerable populations. This experience has placed Professor Hellard as an expert in many advisory roles, including WHO, for setting elimination targets for Hep B and Hep C, and increasing testing and treatments for hepatitis in highly marginalised and vulnerable groups. So without further ado, I'd like to hand you over to Margaret, and mic is yours.
Good afternoon, everybody, and thank you for the invitation to come and speak again on what is an important, we like to think of it as World Hepatitis Day tomorrow, but the festival of hepatitis, viral hepatitis, often runs for the week. So thank you for the opportunity, and thanks for the introduction, Deb. So today I'm going to talk briefly about the impact of hepatitis B and hepatitis C on Australia, our region, and countries globally. But before commencing, I'd also like to acknowledge the traditional owners of the land on which we're meeting, and acknowledge the Wurundjeri people, and pay my respects to elders past and present. So some of you will have heard me speak before, but some will be new to it. So I'm just going to give you up a bit. Thank you. Some of you will have heard me speak before, but others won't. Normally my voice is classified as plenty loud enough to get across any space, but there you go. But just in case you won't, I'll briefly explain the work of the Burnet Institute and then talk more specifically about the work that, some of the work that I undertake there, and obviously why I think you should be absolutely fascinated, interested, and get engaged in the elimination of hepatitis B and hepatitis C response, both within Australia, the region, and globally. So the Burnet, some of you may well have heard of us more recently through our work with COVID. We've been heavily involved in trying to understand the impact of COVID-19 on the community, and as well provide advice and guidance to governments and the communities how to reduce its impact. And a lot of our work is that's the essence of our work, is what is the evidence base we can generate to advise government, but also to work with and advise communities as to how they can protect themselves from something. And this is typical. We're an independent medical research institute. We're as well a non-government organisation. Our work is multidisciplinary, from the lab, where we've been working on COVID vaccines, diagnostics, right through to this engagement in community and development work, in an effort to basically, we're looking for health equity, to ensure that all people, regardless of their circumstances in life, have an opportunity to have good health, which then impacts on all of their lives and the social economic well-being for them and their families. So it is our mission. Our mission is essentially to achieve better health for vulnerable communities in Australia and internationally by accelerating the translation of research discovery and evidence into sustainable health solutions. Apart from COVID-19 and before COVID-19, we really have been working very hard on issues around, particularly with, as I said, where there's people with social and structural disadvantage, viral hepatitis, HIV, malaria, TB, and also behaviours that put people at those risks, such as alcohol consumption and unsafe drug use. And it's really interesting, as I was catching the cab here today, my cab driver and I began to have a conversation about what I was doing and where I was going, as is my wont. And then I said, I'm giving a talk about hepatitis C and hepatitis B. He said, funny thing, I've had both of them. And then he told me his story. And this is typical of the story of people with hepatitis. So he was born in a large family in the time where, when there were large families and a father who was not kind to his mother and basically regularly beat the mother and him, he and his siblings were steadily removed from the household and put into orphanages. And at about the age of sort of 7 or 8, he contracted through the orphanage, he got hepatitis B through a procedure happening at St. Vincent's. And then he got over it and he talked about how that happened. And that's very typical of hepatitis B. And then how he talked about how his brother and his 2 younger brothers had got involved in the drug scene in Sydney and they basically, one had died of a drug overdose when they got involved in that, and he had become also infected with hepatitis C, although it wasn't a big part of his life injecting drug use. He then went on to work all of his life in the publishing industry and various things, and then for one reason or another, he was driving the cab today. He had been cured of hepatitis C a couple of years ago, and he was enormously grateful that he'd had that opportunity of cure. But that's just the cab driver, me coming in from Clifton Hill. There are stories all the time if we want to stop and look at it. And his life circumstances was not as privileged as many of us today. His life circumstances meant he was at risk of both of those diseases, but also we can change his life circumstances and other people's life circumstances by providing them with care. So that's my first sort of wander away from my notes, but I just thought it's just really interesting. A simple conversation in a cab and somebody whose life is changed by a cure, which I'll talk about in a moment. So I have a number of roles at the Burnet Institute. As a deputy director, I provided strategic advice and overview all sorts of things and get involved in the COVID response and whatever else that somebody trips me over on my way to sort of the kitchen or whatever as to what I become involved in. But really what I've been working on for many years is really thinking about the elimination of hepatitis B, hepatitis C, and HIV. And today, because it's World Hepatitis Day, I will focus on hepatitis B and hepatitis C, what they are and why I care and why I think you should care and really why I'd like you to get involved. And get involved, and I know you're already involved, but I'd like you to get more involved because there are big things that need to be done and we need all hands on deck. As Deb said, the theme of this year's World Hepatitis Day is Hep Can't Wait, and it emphasises the need for the world to get involved. People with hepatitis B and hepatitis C cannot wait. They need the drugs that can cure them. They need the drugs that can stop them from getting sick. And their families, the mothers who have chronic hepatitis C infection, need us to ensure that their baby is vaccinated on the day of their birth to stop that child from developing chronic hepatitis C. We have all the tools to do this, but we need people to engage in the global response. We need powerful voices, the leadership in this room, the people you can influence to get involved. So hepatitis B, there's an estimated close to 300 million people still living with chronic hepatitis B. That's sort of in 2020. 1.5 million new infections every year, and close to 800,000, over 800,000 deaths globally from cirrhosis and hepatocellular carcinoma. And the reality is that doesn't need to happen. We do not need to have new infections because we have a fantastic vaccine that can stop people from getting infected with hepatitis B if you give it to babies. If they get that birth dose or early vaccine, their likelihood of chronic infection accidentally passed from mother to child stops. As simple as that. People with hepatitis B, if they receive the good treatments that are available at incredibly low cost, they are off patent. Less than for the year what we had for our lunch today per person, not the whole room, per person probably, I suspect. They could have treatment for the year that would stop them from going on to develop liver cancer, liver scarring, liver cirrhosis and the like. We can change this easily. In our region, we have the highest burden of hepatitis B disease in the Asia Pacific region. So it's a local thing for us. And when we think about diplomacy and we think about soft diplomacy and all the things that we can do for our region to keep them well, to keep them healthy, to keep them safe, and to keep them engaged in a way that makes most sense, we can make a big contribution. As well, in Australia, we need to continue making a contribution because over 200,000 Australians have chronic hepatitis B infection, and many of them still don't know it, and many of them need to be tested for hepatitis B and then receive treatment for hepatitis B. Hepatitis C is the same problem. It's around, the estimates vary, but let's say around 60 million people globally have hepatitis C infection. Again, about 1.5 million new infections every year. And again, close to 300,000 people die every year from hepatitis C related to liver scarring and liver cancers. Since I last spoke to this group, and some of you may remember and some may not, one of the most amazing things, and I'll touch on it in a moment, is the direct-acting antivirals, cures for hepatitis C, had just become available and we're beginning to roll them out. And at that stage, we estimated close to 200,000 Australians had chronic hepatitis C infection and were really at risk. And we've begun the elimination program and we've treated over 100,000 Australians in the last sort of say 5 years since those treatments are available. So we're well on our way to hepatitis C elimination in Australia. But those treatments aren't available to everybody globally, and so there's more to do there. So whilst the numbers, as I said, I've quoted, may seem high, lots of disease, in fact, the reality is if we choose to do something about this, it can be very, very different. And that's because, as I said, we have incredible tools to put into an elimination effort. And we basically need people. We need support, enthusiasm, and engagement from groups such as Rotary for us to achieve the elimination targets that have been set by the WHO. As people have heard me speak about before, I'm a great believer in moments in time. And through my career, I have believed that these are these critical moments where if you seize the day, you can move the dial, you can shift the dial and move forward. That first moment in time was in 1996, when in my career with HIV, when all of my patients who had been dying of HIV, all of them used to die, stopped dying. And I remember distinctly the day I came back from maternity leave, and the first clinic I did back from maternity leave in 1996, and looking after somebody that I seriously thought, as I saw them at outpatients, I thought, I'm admitting this person to hospital to die. And what I hadn't realised is that these amazing new drugs that we'd developed for HIV meant that that didn't happen. He got onto those treatments for HIV, and he is alive today, and I still see him. He's a dog walker and he lives well. He's happy and he has thrived. That was the big game changer for HIV. The big game changer for hepatitis C happened about 5 to 10 years ago now, where we developed a cure for hepatitis C. It was an extraordinary medical breakthrough. One tablet once a day, or sometimes you can have more, but one tablet once a day for 8 to 10 weeks, 8 to 12 weeks, means you can be cured of your hepatitis C. Minimal side effects, super easy to take. So something that previously I had treatments, which I used to poison people regularly and make them feel terrible, we now had cure, and it is real cure. And if you are on treatment, over 95% of people who take that treatment can be cured. So this is one of the most amazing things that we should, and this has not been done before. A similar amazing breakthrough happened in the 1980s with the vaccine for hepatitis B. And again, it is a brilliantly good vaccine, which is effective and increasingly effective with low side effects. And as I said, if we can ensure that every baby born in the world today is given a timely birth dose vaccine plus the follow-up vaccines, we could have it would mean we had no new cases of hepatitis B globally. And it's just something that is so simple. It's a cheap vaccine, but we need people like Rotary to do something about it. So what do we need to do? As Deb alluded to, in 2016, as part of my role with WHO, I was privileged to be involved in the setting of basically the global targets for hepatitis B and hepatitis C elimination. In summary, these targets are trying to substantially reduce the number of people infected. So we talk about elimination as a public health threat. We know we're not going to eliminate totally by 2030, but we can make enormous inroads such that the lives of people in Australia, in the Pacific, in Pakistan, in, say Rwanda, in any country in Africa, can be markedly changed, where we can provide health security. That helps families. When grandmothers in Egypt, I'll just give the example, off text again, but in Egypt, the reason they decided to do, and they've done a most extraordinary elimination program of hepatitis C, is because they realised that the grandmothers and the grandfathers were dying, and they were required to look after the children for the parents to go out to work. So it's health security. So you can put it into economic terms, it helps us, or you can put it into just justice terms and equality. It's really important we achieve this. So what we're trying to do is basically have 90% of people diagnosed. There's lots of details to the targets, but I'm just going to go 90, 90, 90. 90% of people diagnosed, 90% of eligible people treated, and 90% of those treated and cured. So it's really simple. And we're on track for hepatitis C. We are falling behind for hepatitis B because there's still many Australians at risk of hepatitis B who aren't diagnosed. And you might say, well, why is that the case? And the case is because of us, stigma and discrimination against people who are at risk of these diseases. So my taxi driver talked about stigma and discrimination against drug users. And then we had a conversation about who's at greatest risk of hepatitis B in Australia. The people at greatest risk of hepatitis B in Australia are people from culturally and linguistically diverse communities. And we set up systems and structures such that they are anxious about coming forward to have a hepatitis B test, such that they get diagnosed. There is stigma from within their own cultural community, and there is stigma from the Australian community. So as Deb alluded to, one of the very big things we have to focus on is the reduction of stigma. So the strategy that was required to get rid of these infections needs to be multi-pronged. First, we need to engage with affected populations. We need to recognise who's at greatest risk. As I said, for people with hepatitis B in Australia, it's culturally and linguistically diverse communities, and we need to work with those communities. It's also Aboriginal and Torres Strait Islander people are overrepresented for both hepatitis B and hepatitis C. In our region, it is just the countries in our region. In Australia, the vast majority of people with hepatitis C have a history of injecting drug use. Our drug law reform, our drug laws make, I'm just going to say it, absolutely no sense. The war on drugs has been one of the greatest failures of policy, of policing, of every imaginable thing. If it wasn't drugs and the outrage associated with drugs, we would all recognise the evidence and the science, the cost, the punitive nature of this, but instead we don't, and go against all evidence, in the face of all evidence, to keep punitive laws against drug use. And I would love Rotary, every time anybody has a conversation with somebody, just to sort of think, actually, this has got to be the dumbest laws we've ever had. It has been an abject failure. So the war on drugs has led to massive drug overdoses, hepatitis C infections, unnecessary illness and harm to a group of people who are often incredibly, as described by my taxi driver today, socially and structurally disadvantaged. It was not his fault he got taken from his family at the age of 2. It was not his brother's fault that they got taken from their family. They were wards of the state, and we did not provide care for them. We did not provide support for them. And it meant that when he left, a very clever chap, we had a long conversation. He did self-educated, but when he left as a ward of the state at the age of 15, he was given a bag, one change of clothes and $10 and said, good luck, mate. And that's what happens. That's what we do when we release prisoners with a history of injecting drug use from our prisons. Good luck, mate. Hope you go okay, lassie. Whatever we want to call you. We care very little, and it can be changed by simply not incarcerating people who inject drugs. Actually changing our laws, thinking about it. Again, that's off script, but I just wanted to say, and it's also why we have an overrepresentation of Aboriginal and Torres Strait Islander people in our prisons. This is our great shame, and we have to change these things in Australia, and we can, and it's people like us in this room that can change that, because we're the conservative people. We're the people that aren't meant to, like I am so conservative. I was just having a discussion with Deb. I come from a Liberal family background. I've got to say, the frustration with that picture yesterday in the Parliament of a bunch of conservative people not wearing masks against evidence. I come from a Liberal background. We have the right, it's up to us to change these things, because otherwise people think, oh, it's left-wing leaning and this-y and that-y, and it's not. The evidence is there. People like us are the ones that can change these things and support the change to lead to good health outcomes for Australians, all Australians. So to successfully eliminate these infections, we must engage with these key populations. As well, we must raise awareness about hepatitis B and C in our communities like you guys are doing. And thank you for the work you are already doing in this space. We need to reduce stigma. Every time somebody says something which is to do with stigma that might make people, let's correct them. Let's be brave enough to say, actually, that's not the case. Even my taxi driver called his brother who had overdosed a junkie. I said, actually, I don't use that word. Tell me the story of your brother. And then we had a story, and I think, yeah, he's not really a junkie, is he? Nah, he had no hope, and he's not a junkie, so let's not call him that. Prevent new infections through vaccination of hepatitis B and harm reduction programs for hepatitis C. Increase testing and treatment of people at risk, and that babies, even in Australia, not every child gets a birth dose vaccine. Let's have that change, but let's also work to have that change in our region. Because in our region, it's critical we support those countries. Due to time constraints today, I'm not going to go into all the details about the work we do to reduce these infections, but suffice to say, we're doing multiple projects across Australia that aim to engage affected communities around increasing testing and increasing treatment uptake, and really thinking about where does somebody want to have their care. And it's really important that we think that that care is not where we or me as a doctor, a specialist physician provides that care, but where does that person want to have their care? In the community, near them. Why can't they test at home? My argument is that the biggest life-changing test, or the life-changing thing to me, I was able to test in the privacy of my own home to find out I was pregnant with my first child. Most women have been able to figure out how to do a self-based test at home. And it was been impossible. And we've suddenly all realized with COVID, we can all test at home. Why can't you have tests at home for hepatitis B and hepatitis C? Those tests exist, but we don't actually let people, we don't give people the right to do that. Let's bring tests everywhere. Let's flood the market with tests, home-based tests, tests at the GP, tests where you go to the pharmacy. Why do we have these restraints that make it that people can't choose how they want to have their diagnosis in their care? Trust people that they can do this well, and then provide them with the support when they come forward. So it's critically important that we think about these things. Where are the places and spaces that we need to be? So my mantra overall with health is simplify, simplify, simplify. It's like property, it's, you know, location, location, location. With health, it is simplify, simplify, simplify. Basically, most people don't want to spend any time seeing me. So let's make it that they don't have to go up to the Alfred Hospital where I am, but they go somewhere else. And most people don't want to come too often. So let's get rid of all unnecessary tests. Eliminate See Australia, or EC Australia, is the big project that we run, which is aimed at achieving hepatitis C elimination from Australia. We do this in collaboration with LiverWell, Hepatitis Australia and others. And we're making great progress. As I said, we're nearly really 50% of the way there. Hep B, we need to put in a lot more work. And we need to really think about that. So what can Rotary do? Rotary can do a lot, both within Australia, in our region and globally. A key challenge is to raise awareness and reduce stigma. Also, to use your influence to persuade governments in the region and around the world to commit to the elimination effort. I don't need to tell Rotarians the importance of business, professional and community leadership in such approaches. That's what Rotary is. It's using those things. So I invite Rotary again, and I know you guys are doing it, but to really kind of go at it again, to be a global partner in the effort to eliminate hepatitis B and C. Just imagine if every Rotary Club around the world became community educators who raised awareness about hepatitis C and hepatitis B in their community. Just imagine if every Rotary Club around the world committed to help reduce the stigma associated with hepatitis B and hepatitis C. Just imagine if every Rotary Club around the world worked to ensure that every baby got a birth dose of hepatitis B and hepatitis C. And just imagine if you did that to get low cost and advocated for low cost point of care tests and low cost treatments, because the treatments should not cost much, but they do because of structural reasons. So in summary, become champions for the cause. I know you've got your international meeting coming up, and I'm really advocating for you guys to think about having that on the agenda and actually just pushing it forward. It's a huge challenge, but we shouldn't be afraid of this challenge, and we shouldn't be afraid to fail. Again, those who've heard me speak will know that on the back of my door, there's a quote that my mother's favourite, from Theodore Roosevelt. And it goes, "It's not the critic who counts. The credit belongs to the one who's actually in the arena, whose face is marred by dust and sweat and blood, who at the best in the end, the triumph knows the triumph of high achievement. And at worst, if he fails, at least fails whilst daring greatly, so that his place will never be with the timid and cold souls who know neither victory nor defeat." I would like to ask Rotary to join us in our quest and be part of the brave rather than timid souls. Let's eliminate this disease, both of these diseases. It's possible, but we need support, and we won't get there without you guys coming on board. So have a think about it, and thank you very much for the invitation.
So next up, we have Frank Carlus to give us a bit of insight on his experience with HEP.
Thank you very much, Deb, and thanks, Adrian. Rotarians, friends, I think the last time I spoke to a Rotary Club was just a couple of weeks before the COVID pandemic hit us, and it's been a very difficult and different time in that ensuing 2.5 years, I think. So I'm really pleased to be back here with you this afternoon to support you with your work in this project, and in particular to share my lived experience with hepatitis C. I've got a long history working with the Victorian government, and in particular in their areas of health and community services. And in a number of roles that I've had, I've encountered Rotarians in all walks of life. And so I'm very aware of the important and positive roles that Rotary and its members play in the community. And I'm really looking forward to continuing to work with you on this particular project. Can I also thank Margaret for her presentation? It's always a pleasure to share a podium with Margaret, even though she takes too much time at times, but that's okay because her words are really important, I think. Although I've got a professional interest in the health sector and in the community sector, for me, hepatitis is very much a personal issue. You see, I'm what euphemistically we call a person with lived experience. In my case, that's actually hepatitis C lived experience. Of course, the affected communities are very diverse and it's often dangerous to generalise. But I want to give you a snapshot of the potential impacts of hepatitis by briefly sharing my experience with you. My family migrated from Spain in 1969. And like all migrants, we went through a migration process and pre-migration health checks, came through flying colours, no problems, and then we were allowed to migrate. However, in the early 90s, following a routine health check, I was diagnosed with hepatitis C, to my surprise. And I was told at the time, when you get diagnosed, people, the doctors will, or nurses will talk to you about risk factors. What risk factors have you got? How much you have got this virus? That was done with me, and it came down to potentially, and most likely, it was the fact that I'd been immunised in Spain as a child. And it came as a shock to me and to my family. In fact, my family was probably in denial initially, particularly my parents, because they considered themselves somehow responsible. They had been the ones taking me to get immunised after all. But perhaps also they didn't know much about hepatitis C, but they intuitively understood the stigma that is attached to this family of diseases. And there was worse to come, because it was suggested that given my risk factor, that the rest of the family should be also checked, should be tested for hepatitis. And again, to our great surprise and shock, my mother and my younger sister were discovered to also have hepatitis C. Still, at the time, we were all healthy and there was no treatment anyway. So it was a case of wait and see and hope. By the late 90s, my health was seriously deteriorating. My liver had become cirrhotic, and Margaret talked about that, and it's scarred. It means that it's not doing the job. It's not able to do the job that it's there to do, which is really to remove toxins from your blood, etc. And so when that happens, you become quite sick. Because that means that when your liver's not doing its job, it's putting pressure on every other organ in your body. So I had episodes of encephalopathy, which is what happens when those toxins are not removed from your body, your bloodstream, and they go to your brain, and your brain gets all confused and you become all confused. And worse. It's a horrifying experience for anyone who's experienced encephalopathy, and not just for me or for the person who's suffering it, but for those around you, your carers. In fact, I don't think I exaggerate when I say that early in 2000, I was close to death and I had to undergo what they call a life-saving liver transplant. I'm not sure if you've experienced anyone with a terminal condition like end-stage liver disease, and I can take questions privately or openly. It's difficult for the patient, but it's even more difficult for the family. And it's more difficult when you don't have the support of family and others. The transplant was not easy, and it did save my life. And I consider myself very fortunate, for although we have an excellent track record with liver transplantation in this country, there's really no guarantees. I've seen other patients die on the waiting list, and I've seen a number of patients who've been successfully transplanted, but who unfortunately are not with us because not every outcome is as good as what you can see here today. So yes, I've had a great outcome, and I'm almost immediately returned to good health. It's an amazing transformation when you have a transplant, when your appetite quickly returns, the proper colour in your, you lose the jaundice look on your skin, on your eyes, etc. And within 5 months of my liver transplant, I was able to return back full-time work. Quite amazing, considering I'd been pretty much on my deathbed only a few months before. So you might think, well, that was a great story. It was hard for a while, but, great outcome. And the story. Hepatitis C doesn't leave your body. Hepatitis C is in your bloodstream, and you can have a liver transplant, but that doesn't get rid of the virus. So you might, then it's really then about what happens to your virus. And I think I'm going to get the wind up here, but I'll just persevere for a second. So you start to recover very, very quickly. Fortunately, in 2015, I was given compassionate access to the direct-acting antivirals that Margaret talked about, and voila, I was rid of hepatitis C, no trouble. My younger sister was also subsequently cured of the virus through the same drugs. This is not just, my mother, unfortunately, it was too late for her. She'd passed away from liver disease, from liver cirrhosis. So this is not just my story, it's the story of the taxi driver. It can be the story, can be your story, can be the story of someone in your family. It can be the person who's serving you at the cafe. It can be your accountant, it can be your lawyer. It's not confined to, one class of people. I just want to finish off on the story of my mother, who was well connected to her GP and had first-hand experience of my journey, and yet she was not able to have that conversation with her own GP. And worse still, her own GP, knowing that she had that diagnosis, didn't see that there was anything that they could offer, didn't think that it was appropriate to raise it. That comes down to that stigma and discrimination that prevents people from raising the issue, and today being able to access diagnosis and treatment and successfully clearing the disease. Many, many people, as Margaret has said, have already cleared it in Australia and across the world, but the fatality rate is still quite high. It's akin to the road toll in Victoria, and we don't accept the road toll, and we shouldn't accept death due to hepatitis. It is a case of hepatitis can't wait. My mother couldn't wait. She had to wait, unfortunately. But, it's not something that we should be leaving for tomorrow. We need to tackle it each and every day. We need to tackle it today. And I am so glad that we've got Rotary on our side and on that quest, because I think together we can make a big difference. So I think I am now out of time. I'm going to leave it there. But thank you very much. Please stay with us on this quest. We really appreciate it, and it is very, very worthwhile. Thank you. Good afternoon.
Well, thank you. Thanks, Margaret and Frank. And unfortunately, we are out of time, and I'm sure we'd all have a few questions up our sleeves. So I just want to take this time to thank you, Margaret and Frank. We could talk for hours on this topic, and Rotary will take you up on that, and we already have with the End Hepatitis Now project. Unfortunately, COVID has come along and it's slowed that right down, but we're onto it. So to thank you, we have a couple of gifts for you. So the gifts are 2023 socks and centenary moments of Rotary book, and the 2023 socks we like to say are 200% Australian made by our past president Phil Emersby, and of course they're made in Australia. So